My name is Mary Mannix and I'm CEO of Augusta Health. I've been here for 15 years now, and one of the most exciting initiatives we've undertaken is our clinical affiliation with the Mayo Clinic Care Network. Recently, we approved a strategic plan for Augusta Health that has a vision of being a national model of community-based health care. And our affiliation with the Mayo Clinic Care Network satisfies that model of seeking meaningful clinical relationships with a provider that has an incredible reputation of being one of the best healthcare systems in the world. Strengthened the opportunity for physicians to have access to continuing education resources. It's been one of the best decisions we've made.
My name is Witty. I'm a neurologist at the Mayo Clinic, and I've worked at Mayo for over 25 years. I also have the honor of serving as the medical director for the Mayo Clinic Care Network. A little over 10 years ago, Mayo Clinic started a new activity, the Mayo Clinic Care Network. And the Care Network is meant to build long-lasting, clinically meaningful relationships with like-minded healthcare organizations and thereby be able to interact with many physicians.
I'm Clint Merritt. I'm the Population Health Chief at Augusta Health, and we have been 1 year in the Mayo Clinic Care Network. And even in this first year, it's easy to see a lot of meaningful change occurring because we're part of this collaboration with Mayo. We have a network set up that very efficiently connects frontline care providers with experts in Mayo to help us solve pretty challenging clinical problems. So to give you an example, we've had over 15 specialties at Augusta send e-consults to Mayo in the first year for cases that are challenging to diagnose and challenging to manage. And what they're doing is lifting up a case that has a lot of complexity to it, and we get connected with an expert in the field at Mayo, and we end up getting back really valuable clinical guidance on managing the case.
Our affiliation with the Mayo Clinic Care Network has really exceeded our expectations in the first year. It's like any relationship, what you put into it is what you're going to get out of it. And so we've worked in a very intentional way about rolling out all of the great services to our clinical care network, our clinically integrated network. And there has been just a tremendous amount of enthusiasm and utilization of all of these services. And we're excited about moving into year 2 and even leaning more so into these wonderful services, opportunities, engagement, and networking.
I'm Allison Barako, an infectious diseases physician at Augusta Health. I've had the privilege to work with Mayo Clinic Healthcare Consulting Tool and directly with subject matter experts to help us implement hospital policies that will bring better patient safety to our community. Having the ability to use a subject matter expert at Mayo helped us implement best practice for hypothermia management in our operating rooms.
Hi, I'm Stephen Brawley. I'm a family medicine physician at the Augusta Health Crozet Primary Care Clinic. We've been here a little bit more than a year. I like using Ask Mayo Expert because it's a quick and convenient database that I use for point-of-care decisions. I recently had a new patient with hypokalemia. The etiology was not known, so I used Ask Mayo Expert. Gave me a very nice algorithm for how to work them up. I've been using it ever since.
My name is Jessica Collins. I'm a physician here at Augusta Health, and I specialize in endocrinology. I've been here for 9 years, and over the past year I've really enjoyed our new relationship with the Mayo Clinic. I have consulted them electronically and to ask for additional opinions on patients who have had complicated problems. And they've been able to offer us additional clinical directions that have really helped those patients. In one circumstance, they guided our evaluation of the patient so that we made a rare diagnosis, and that patient will really be helped by the additional information. So I am grateful for the new relationship and the additional opportunities that we can give patients and the clinical care that we provide here.
I'm Stephanie Gideon. I'm the Administrative Director of Nursing Quality and Process Improvement here at Augusta Health. I wanted to talk a little bit about Mayo Clinic and what it means here for our community hospital. It's not just about the Mayo Clinic and all of the expertise that they bring to the table, but it's also about networking with like facilities. We've really worked on a lot of projects for not just our patient quality and patient experience, but also our team member experience and enhancing their onboarding as well as their work-life balance.
My name is Annie Ott-Young. I'm a registered nurse at Augusta Health on the medical unit. I started a residency project on fall prevention and safety for patients on the medical floor, where I felt like there was a need to promote more safety for the patients and more fall education for nurses. I reached out to Mayo Clinic, who set me up with a webinar on fall prevention measures. They introduced things like the Hester-Davis scale, use of virtual monitors, and all the different interventions that you can put in place to promote patient safety and try to prevent patient falls. I introduced my project and presented it to our fall committee at Augusta Health, and we are trialing the use of Hester-Davis scale and increased use of virtual monitors in our facility.
This is Mahfouz Haq. I'm the Chief Medical Officer at Augusta Health. As a physician, we always depend on the fellow physician who might have the answer that I don't. And Mayo Clinic has given us the opportunity to ask that question without any hesitation.
On behalf of our whole team at Mayo Clinic, it is a great privilege to congratulate the entire Augusta Health team on their one-year anniversary with the Mayo Clinic Care Network. This year has really solidified our hopes and expectations, as we have seen excellent work from the Augusta Health team. We also see the opportunities for the future to share knowledge and experience, not only from Mayo, but the entire network. And we're excited. We look forward to the journey ahead, and we congratulate you on this past year and look forward to future collaboration.
I just think that joining the Mayo Clinic Care Network has been a real advance for community care here in this region of Virginia, and our affiliation with the Mayo Clinic Care Network is only going to grow, and we're excited about that.